New, fresh, hot article published in April's edition of the American Journal of Emergency Medicine that pushes back against the narrative that paramedics do more harm than good when we intubate. They studied outcomes in pre-hospital intubation of patients with traumatic brain injuries, which I submit are a very large percentage of patients we intubate in the pre-hospital environment. Certainly, TBI accounts for the majority of patients my flight team ends up intubating on scene flights. So this is definitely not pedantic nerd shit, and it's very applicable to what we do in the pre-hospital environment. I mean, duh, that was redundant because it's talking about the pre-hospital environment. Anyway, this was a meta-analysis. After performing a literature search, they filtered it down to 24 studies, 22 observational, 2 were randomized control trials. In total, these papers accounted for 56,543 patients between 2003 and 2022. The primary objective was looking at mortality between pre-hospital intubation and in-hospital intubation. They also looked at morbidity as a secondary outcome. So the patient didn't die, but was one particular group sicker, or did they experience more complications? And initially, they found no significant statistical difference in the primary outcome of mortality. No difference between pre-hospital and in-hospital intubation, which definitely differs from what researchers like Henry Wang have published and made mega public in the nerd sphere of the EMS physician community. However, it gets better for us. They performed a sensitivity analysis to test their findings and see if altering a method, a variable, something led to a different final interpretation or conclusion. After performing the sensitivity analysis, the results changed dramatically, and they found that pre-hospital intubation was associated with reduced mortality compared with doing it in the hospital. And the 2 studies in the meta-analysis that really stood out and supported that pre-hospital intubation reduced mortality, these were the 2 randomized control trials, which are the gold standard in testing and intervention. From these studies, the authors extrapolated that it is critical to make the patient, quote, vitally stable prior to intubation. Go figure, resuscitate before you intubate. And remember, we want to avoid the 3 horsemen of TBI like the plague, because even one incidence of any of these can double mortality. As far as morbidity, the results were not statistically significant to show that pre-hospital intubation had less. However, doing the intubation pre-hospitally did not appear to make morbidity any worse. They did write that there were some findings that conveyed favorable morbidity outcomes when done in the pre-hospital environment, but they weren't enough to write that there was a causal effect. And always, this is a short reel. I'm blasting out new, sexy information that's piping hot off the press. Go out there, read it for yourself. Look at the research methods, look at the strengths, appraise the weaknesses, and you be the judge, be the research critic for yourself.